First up, we have a series of 3 bills related to vector control within the Department of Health, the dengue fever outbreak on the Big Island. So we're going to take each of these bills up separately, members, but rather than take questions at the end of each bill, what we'll do is we'll hear all 3 and then proceed to ask questions. Okay? So first up on House Bill 2061, making an appropriation to the Department of Health to reestablish a vector control branch. Members, there was a proposed HD1 that was drafted in collaboration with the Governor's Office. And that has been posted for several days at this point. And this requests an emergency appropriation for this year and an appropriation into next year. We already identified some defects with the bill, and there have been some developments within the Department of Health. So first up, I'm going to have perhaps Department of Health come up first to explain what the situation is.
Good morning, Chair Bellotti, members of the committee. Thank you for the opportunity to testify. I have with me Keith Kawaoka, who is our Deputy Director for Environmental Health Services for the Department of Health. He's also the Incident Coordinator for the Department of Health for the Unified Command under Daryl Oliveira on this dengue outbreak, and I'm going to let him start with the testimony.
Good morning, Chair Bellotti, members of the committee. My name is Keith Kawaoka. I'm the Environmental Deputy Director for Department of Health. As you mentioned, Chair Bellotti, we've been working with Budget and Finance in the Governor's Office the last few days, working out some of the immediate concerns, which I'll go into in my testimony, as well as working out more of a long-term solution as well. So what the testimony is going to reflect is the latest that we have right now. So it may not be exactly what the bill contains, but we feel that we don't need an emergency appropriation at this point. We're working with internally to work at immediate needs at this point.
Mr. Kawaoka, as you're going through your testimony, members, the Department of Health's testimony is in the late folder in your files, so it is there if you want to pull it up as Mr. Kawaoka is talking.
Okay, thank you. If I may, before I begin my formal testimony, I just want to generally acknowledge the many hardworking state and county men and women who have been working on this response for the last few months. They've been given willingly to accept the challenges to engage in this outbreak. Their various disciplines are very broad across the state, but their commitment is very deep, and they have truly sacrificed their personal livelihoods and main duties to fight the bite. I'd also like to recognize the very strong relationships that we have with our many county, state, and federal agencies as well, particularly the County of Hawaii personnel have been steadfastly involved from the very get-go. In particular, Chief Daryl Oliveira, who's our incident commander for this incident, has provided the entire team with leadership and direction in this effort. So with that said, the outbreak has occurred from October 2015. So far, fortunately, has been confined to the Big Island, mainly due to the combined efforts and concentrated efforts of the people that I mentioned previously. Our 4 vector control staff on the Big Island especially have been responding to this outbreak from the very beginning, often on occasion 7 days a week, by conducting surveillance, spraying operations to reduce the mosquito population, and doing public outreach via telephone or door-to-door visits. And this is both department personnel as well as county personnel doing this outreach. Our other 13 other vector control workers on Oahu, Kauai, Maui have also been flown to the Big Island to provide additional assistance, in addition to maintaining their current respective work on each island. We've also been augmenting the very small vector control staff with other program staff statewide, not just in the environmental health area, but the other environmental management areas as well. So as the outbreak continues into its 4th month, the department has developed strategies both for immediate and long-term solutions to continue the response operations with vector control and other staff. You may remember that the Centers for Disease Control, CDC, came late last year to evaluate the response operations. And they basically, in summary, basically said our operations, the total operations, was appropriate, timely, and even exemplary in many areas, particularly in the epidemiological response, entomology assessment and control measures, community and healthcare providers outreach, as well as laboratory testing. However, the CDC report did note some shortfall and deficient areas, particularly in the current outbreak if it escalates or does spread to neighbor islands. And these are in the areas of vector control, entomology support, as well as communications capacity. So the department concurs with these assessments, and we feel that a fully established vector control program to the levels from 2009, we will be able to move effectively to manage these outbreaks such as dengue fever and the newly emerging public health threats such as Zika and chikungunya viruses, all transmitted by the mosquito Aedes aegypti. So in summary, we appreciate the legislators' keen interest in this response. The department looks forward to working with you in developing appropriate solutions to this outbreak, as well as potential future public health threats. Thank you for the opportunity to testify.
Okay, so members, to clarify, looking at Mr. Kawaoka's testimony, the bill really is now asking for an appropriation to restore vector control to levels and staffing and budget levels pre-recession, before we had the massive cuts. It's looking at $1.9 million to increase and hire up to 37 full-time FTEs, including a communication specialist, which responds to the CDC report that happened later this year, later in 2015. Could you speak to, and I apologize, I'm going to use my prerogative, can you speak to what monies have been moved to address the current fiscal year? Because I don't see that in your testimony, Mr. Kawaoka.
Yeah, thank you for that question. The immediate support, which is to support 8 vector control workers and entomologists and communication support, we're using basically the restricted budget, the hard 5% restriction. We did have a release from BNF for the initial 5% earlier to get us started. And then the additional amount is to provide immediate support to the Emergency Operations Center for those kinds of support.
So hence no need for the emergency appropriation. You have tapped the funds that have already been allotted for fiscal year 2016.
Correct. Remaining of fiscal year.
Okay, thank you. All right, members, I'm going to go through the rest of the testimony for this. So this is on the appropriation for fiscal year 2016, 2017. As you imagine, there's all of support. You can stay there and I'll just call up if anyone wants to add to their support. They're welcome to do so. Mr. Vern Miyagi, State Department of Defense. Thank you, Mr. Miyagi. State Department of Defense Major General Arthur Logan. Thank you. Testimony in support, Council Member Fresh Onishi. Testimony in support, Elton Oshio, County of Kauai Civil Defense. Testimony in support, Chamber of Commerce, Connor McKenzie. Testimony in support, Hawaii Farm Bureau. Testimony in support, Kohala Coast Resort Association, Stephanie Donoho. Members, numerous individuals in support, Heidi Bergwat, Rebecca Gonzalez, Craig Nelson, Jason Graham, David and Usichi Snover, Jeff Muir, Joy Marshall. Other late testimony in support, Paul Breeze, Marjorie Irway, Maureen Data, Michelle Higashi, Natalie Saint-Seven, Edward Rao. Many of these are Big Island residents members. And we also received late support from Melvin Kaku, Department of Emergency Management, as well as Chief Dara Oliveira on the Big Island. Finally, members, there was other testimony in support. Corey Yost, this is all in your late files. Don Awo, Douglas Perrin, Josh Atwood, Kristen Teranishi, and Miley David, Hawaii County Council. Okay, we're going to be able to come back and answer a whole bunch of these, but I want to move on to the next bill, and then the third one, and then I'll open it up to more questions on all 3 bills. House Bill 1745 is relating to health. This is the establishing a disease outbreak response fund for epidemic control. Another interesting aspect of this bill is to authorize the Director of Health rather than the governor to declare an epidemic, and then makes an appropriation. So first up, I'd like to have the Department of Health testify as to this bill.
Thank you, Chair, members of the committee. We appreciate this request. We respectfully request that this measure be deferred due to existing mechanisms for funding disease outbreak response. And the concept of a disaster relief fund is intriguing and would be worthy of further discussion, I think, offline. However, the added value of the declaratory powers, the spending caps, and reporting requirements proposed in this bill is not immediately apparent. For example, Department of Health may seek an emergency appropriation from the legislature, a Treasury loan, or seek federal disaster declaration designation and other protocols. So we sincerely appreciate the intent of this bill, and we strongly recommend robust funding for our routine population health preventive practices and surveillance as an alternative. Thank you.
Okay. Members, we had comments from the Attorney General. And, go ahead, Mr. Goto. Okay, you can stay there.
Good morning, Chair, members of the committee. The comments from the Department of the Attorney General are pretty much technical in nature in that the bill would create a new section in Chapter 325 Hawaii Revised Statutes that would require the Director of Health to submit requests to the legislature for appropriate general funds to respond to an outbreak. Our comment mainly is that the new section lacks wording that would actually establish the fund, specify the type of fund that is to be established, and specify where that fund is to be created. And so our testimony includes a recommendation for additional language, adding a word to the title of the new section, and then additional language at the beginning of that section. So we're, of course, we would also ask for conforming amendments on page 5. So if you have any questions, we're available for that.
Thank you. Members, in your late testimony, we have testimony comments from Department of Budget and Finance, much along the lines of whether the fund is appropriately named, whether it's what we're creating precisely with the fund, sealing stuff. So all your great budget and finance type of stuff. And we have testimony and support from Donna Woe. Okay. Any other testifiers? Please come up. So this is on House Bill number 1745, the Disease Outbreak Special Fund.
Okay, I'm sorry. I thought there was the dengue one.
Okay. All right. Seeing no other testifiers, now we're on House Bill 2234. Members, this is relating to dengue fever, and what the main point of this calls for is a management audit of the Department of Health, as well as appropriating funds for mosquito assessment and control efforts. So first up, we have Department of Health.
Thank you, Chair, and members of the committee. We welcome an audit. There's nothing there for us to hide. We'd welcome that. Regarding the other portion of House Bill 2234, we would prefer the language in the vehicle of House Bill 2061. Thank you.
Okay. All right, members, we have testimony from Kohala Coast Resort Association in support. Testimony in support from individuals Paul Breeze, Marjorie R. Irway, Maureen Data, Natalie Saint-Savine, Edward Rao. And in your late testimony, support from Corey Yost, Donna Woe, Douglas Perrin, Karen Eoff from Hawaii County Council, as well as Miley David from Hawaii County Council. Do we have any other late testifiers? Mr. King?
So I'm here officially this morning on behalf of Congresswoman Gabbard. We will be submitting official testimony related to this hearing shortly. She did want me to pass on a message from her. On October 21st, 2015, the dengue exposure rate on Hawaii Island was 1 in 185,079. As of January 27th, 1 out of every 853 of our constituents and 3 out of every 50,000 visitors has contracted dengue fever. This constitutes an approximate infection of 66 residents or 6 visitors every month. Additionally, the same mosquito that carries the dengue fever is also a carrier of the Zika virus, which is spreading explosively, according to UN health officials who are currently considering an international health emergency. The increasing rate of dengue exposure requires more than further consideration. The swift, decisive action at every level to marshal the resources to halt the spread of dengue and prevent the entry of Zika. I strongly support HB 2061 and 2234. It is necessary action to protect the people of Hawaii Island and our state from this tragic outbreak and prevent something far worse from occurring. More than a third of the world's population lives in areas at risk for infection from dengue virus, which is the leading cause of illness and death in the tropics and subtropics. As many as 400 million people are infected annually. Coordinated efforts by all sectors of government, with the private sector and the community, will result in halting the growing numbers of locally acquired cases of dengue fever. The people of Hawaii need protection from a virus that has no vaccine, so we do not remain part of this incurable worldwide epidemic. I hope for the passage of HB 2061 and 2234, and I look forward to our continuing partnership to protect the people of Hawaii. Mahalo, Tulsi Gabbard, Congresswoman.
Thank you, Mr. King. And we really appreciate the Congresswoman's focus on this. We understand that she has been very involved. I know you've been very involved in the daily operational, weekly operational calls of the state. So thank you for being here.
I also want to inform the committee that we will be submitting a formal letter to the CDC for additional resources and support. That will happen very shortly.
That would be tremendous, because I think the need for federal funding, we're tapping, as you can see, we are tapping as much of our state funding that we can, but with our budget cycle, we are not going to be able to release anything more until after July 1st. The department, as you've just noted, has moved as much money as they can into the area. So we wait our appropriation cycle, so any help from the federal government clearly is very welcome.
We will definitely be working at every level, and we understand that, and we will be pushing hard for the CDC to do more.
Thank you. Any other late testifiers on House Bill 2234? All right, seeing none, members, I'm going to open this up to questions on all 3 bills. And we have members of Civil Defense here, as well as, I think, the appropriate Department of Health folks. Representative Kobayashi.
Just a technical point. In our last committee, in our park committee meeting, AG, I think, was overly nitpicking about the unconstitutionality of a bill regarding the title, saying that intervention and prevention constituted 2 separate subjects. Given that kind of nitpicking, which I think is wrong, the first bill has a defective title, I think, because it seems that Section 4 deals with additional resources, and only Section 5 deals with the so-called reestablishment of the vector control branch. So for purposes of being abundantly cautious, I would suggest that maybe the second bill with a broad title be used as the vehicle for moving the bill.
I think that might be a good recommendation, so that's something that I will take under advisement. But I do think that just a broader bill title will satisfy all the attorneys.
The other thing is that Section 4 with the $500,000 for additional resources is for County of Hawaii only, and I'm not sure whether you want that, given that maybe something could happen on another island.
Well, actually, we have Dr. Kawaoka address that. We have flexibility because what's happened is we've had release of the restricted funds, so we're not restricted to the language that was in the original version of this bill. So, Keith, you want to address that? The reason that we're ramping up right now on the Big Island is to get a dedicated entomologist there and some other resources, but then that frees up the other state resources to go back to their respective islands until we can rebuild the branch. But
That's correct, yeah. The release of the other 5% restriction will allow us to use all the resources to, basically for all islands. It's a statewide budget. But thank you for that comment.
Members, other questions? Representative Morikawa?
I remember before when the vector control branch was well funded and staffed, you used to also go out on complaints on rats. Is that correct? Mice,
correct.
fleas, ticks? Because I'm trying to figure out vector. What would you guys consider vector? Because I want to at least make it known that vector is not just about mosquitoes. So can you give us some examples?
Yeah, thank you for that question, Representative Morikawa. Vector, as the name implies, is just a mode of transmission for diseases to go from human to human. Like in dengue, for example, it cannot be transmitted from humans to humans. It cannot be transmitted via a vector like an insect, like a mosquito. Certainly, in terms of the other types of vectors, non-insect, you recall the Chinatown rat situation that also transmits diseases as well to the human population. So, vector control in the true public health sanitation definition is a fairly broad area that would include those kinds of insects and rodents as well.
Right, thank you. So that's a good investment for Hawaii into the future for many other things. Thank you.
Any other questions? Dr. Cregan and then Representative Kobayashi.
One of the things that's come to my attention just in the past couple of months is, we're very concerned about these other diseases coming in here like Zika and chikungunya. The two virologists at Jabson have been trying to get Zika and chikungunya in the state for 4 years, and it's been bottled up in the plant quarantine branch. So I think that, while that's not immediately addressed in this, when we think about reorganization and building up a capacity, we have to think also about maybe transferring some responsibility for things like bringing viruses in to the health department rather than the plant quarantine branch. Scott Enright said he's going to look into that, and it's how things get bottled up in the lower levels of bureaucracy, and but that's been held up for 4 years, and they have the capacity to develop in-state testing, and they did do that during the Maui outbreak. I think that they should also be the Jabson resources should be brought in the School of Public Health. So you have a more integrated thing, approach to the whole thing. In terms of the vector control, I think it needs to be very flexible, and how many full-time positions or part-time positions, or the ability to have people who are trained to train volunteers to be sort of part-time entomologists or vector control people. I mean, the Big Island has been very energized and are being very proactive and training themselves how to make mosquito traps, or how to use them appropriately. And we have to think about the strategy, because there's two strategies. There's one is for the Big Island, and on Big Island it's the dengue control plus the mosquito control, but they have Aedes aegypti, whereas the rest of the islands don't. But albopictus is an effective vector for chikungunya. It didn't used to be, but so that needs to be addressed on the other islands. I think we can practice with the Aedes aegypti, but then we need to step it up to the albopictus control. So I just asked you to think about those things as we sort of get these things integrated.
Representative Cregan. Representative Kobayashi. Do you have an additional
Just
question?
a technical point. Maybe you can handle this in the next committee. Maybe you should think about language in the bill allowing you to hire some of these people on an exempt basis for perhaps a year or 2 years. That'll give you time to reestablish, do the reorg, to do the description, to get, how would you say, front-loaded on the hiring process, and then hire on a temp basis as quickly as possible.
That's an excellent point, Representative Kobayashi. Certainly, to get us through this fiscal year and into next year, should the legislature grant us those authorized positions on a permanent basis, we are going to bring the vector control workers on an exempt basis so that we can get those people as soon as possible on the ground on the Big Island. So that's what we're trying to do on Act 160.
So we're using existing exempt positions that are vacant anywhere in the department, and we've got we're taking from any place in the department we can find in order to fill those positions expediently, and then that's on a temporary basis until we rebuild the branch. So we agree with your comments.
I'd like to follow up on that. So, looking at the structure of vector control pre-2009, it would have had to have had a program manager as well as staff on Oahu and then staff on the neighbor islands.
Right.
And I just want to understand and educate the committee. We currently don't have a program manager,
Correct.
right? It's now being overseen by who in the Department of Health?
Well, in terms of the vector control program, Lynn Nakasone, who's our division chief for Environment Health Services, oversees the vector control program. As far as the neighbor islands, the district health office oversees the vector control from an operational standpoint. Certainly, Lynn from Oahu provides that technical support as well. So there's different levels of management depending on the island. But that's
Okay.
how it's been developed, certainly for the neighbor islands.
Okay.
The district health office oversees vector control.
But Lynn really has, Ms. Nakasone really has actually, as branch chief,
Yes.
has actually
Division chief.
many, division chief, actually has many programs under her. So
Yes.
really you need a program manager.
Yes, correct.
Now, is that program manager typically someone who's like an entomologist? What is the qualifications and the necessity? Like, I feel like that's going to be a person who's going to have to have a lot of technical skill. And this may be a person who we need to look at really exempt first and then move into the civil service. But that's the expertise level that we need. Can you talk about what that position looks like?
The environmental health program manager, yes, would have that kind of requisites in that area. However, it is a management type of position. We do have entomologists also resident within the vector control. Particularly on Oahu, we have the vector entomologist 5 and 6 level that can provide that kind of technical guidance to the neighbor islands. We're also requesting support for authorized positions on the Big Island, especially for on all islands for the entomology support as well, to be resident on each island.
Okay. Now, in rebuilding on each island, what are we looking at in terms of vector control workers on each island that we would have to add? We know that the big number is 37 statewide, but can you break it down island by island so that our island representatives can begin to advocate for those positions?
Can do that. And we can provide you that in more detail, but we're basically looking at, and I'm not differentiating different types of positions because we have vector control inspectors, workers, entomologists as well. So for island of Hawaii, we're looking at 8 additional positions from the 6 they have. Maui, we're looking at 8 additional positions from the 4 they have currently now. And Kauai, another 8 positions from the 4 they have now. So we're looking at approximately 36 positions for vector control entomology.
Okay. And really, I want to stress to the committee members, this is about rebuilding a statewide system. That's why there are so many additional requests on all islands, so no island is left out. And there is also additional request for Oahu Island as well.
That's correct.
I have one last question. When these positions were laid off or gotten rid of, is it possible that those employees can come back? Have they moved into other divisions, maybe, or departments, maybe, and they would be wanting to come back like immediately?
There are some. There's a recall list, if that's what you're asking for, that is based on that 2008-2009 RIF that happened. So the individuals that we're talking about 8 years, 7, 8 years past. So those people may not be here anymore. They may have other jobs by then. So but according to our,
But they would be-
they would be available for recall
Right.
if necessary,
Okay.
if they so
I know
choose.
one on Kauai. Thank you.
Good.
All right, any other questions? Representative Jordan and Representative Kobayashi, and then we'll move on to the next bills.
So if I hear you correctly, you're looking at 37 positions. I don't want to talk about the 3, but the 35 staff positions. You're currently saying that you may have them in-house.
No, these are new positions.
New positions,
We
so-
have right now about 25 total statewide.
What we were talking about in-house was the immediate that we're working on, like today. We've got somebody on the
Oh,
Big Island we're hoping
right.
to get back on board as within the next few weeks.
Yes.
And so that's for the 8 positions on the Big Island for the immediate action with our released restricted funds. But what we're talking about here is in the bill for rebuilding the branch above and beyond those 8 positions that we're filling right now with released restricted funds. And we're trying to find those vacant positions within the department now so that we can fill them immediately.
So what I'm hearing from you is with the release of the restricted funds, you already have 8 warm bodies that you can probably...
No.
We
No, not
have
yet.
funds in order to be able to pay for 8 warm bodies that we need to find and redescribe empty positions in the department right now. And so we're in the process of doing that. We've identified 2 yesterday that we're ready to fill. And so we've got all hands on deck finding where do we have vacant exempt positions that we can redescribe for this purpose to fill right now.
That's a question Representative Kobayashi was asked, just to get us through this fiscal year.
Yes.
You know, the request for the permanent positions is for FY17 and beyond. But the requests right now and that's why we don't need an emergency appropriation. We can use existing budget restriction money for that.
So I'm more concerned on being able to fill them.
Yeah.
I mean, sometimes it takes almost a year to fill a
Yeah.
position. Once you find that position in your vacancies to say, we can use this position.
Believe me, I fully concur with that. So the 8 vector control worker 2s that we are trying to get on board through this basically exempt positions under Act 160 special projects, we feel we can get those 8 on board pretty quick because we've been interviewing for vector control workers on a permanent basis. So we have a roster to begin with. What Dr. Preslow was mentioning about the 2 positions that we're trying to use, vacant positions to fill. One is the entomologist position, which, but whatever happened, we have that person already available to staff it immediately. There was a person that got riffed in 08-09. The communications specialist position, we already have that ready to fill. Our communications specialist is actually looking at possible candidates to fill that position immediately. So we feel we can staff those 10 positions fairly quickly within the next month.
Within the next month?
Yes, or sooner.
On the current 8 that you're looking at?
Correct.
Yeah, the bigger challenge will be, as Representative Kobayashi mentioned, with the request for the $1.9 million in the new year to be able to fill those positions.
And then
That's a
staffing those
challenge.
up.
Yes.
So I'll leave those questions for the next coming. Thank you, Chair.
Representative Kobayashi, one last question, and then we're going to move on.
Okay. Yeah. You know, in terms of zoonoses, you know, leptospirosis is one, brucellosis is another. You know, David Sasaki was the state veterinarian in the health department and did a great job of that. But my understanding is you haven't been able to fill that position for some time, the state veterinarian in the health department.
That's within the Department of Agriculture.
No, but David Sasaki, what was his position? He was in the health department,
Don't know.
wasn't he? He was the leptospirosis expert within your department.
I'm not sure.
Melissa Veray will call.
Okay.
Well, I'll let this go on for about 30 more seconds, but then we'll follow up on
He's
this.
a pretty important person.
Hi, Melissa Veray, Deputy State Epi. There was a vet within the division, or the Disease Outbreak Control Division. My understanding, this existed prior to my arrival, but my understanding is they were unable to recruit anyone for that position.
Right, but does this position still exist?
I do not believe the position exists anymore, but I would have to check my records. I would
Okay,
have to check
because
my
that was a pretty
records.
important part of the
Yeah, no.
leptospirosis in Bruce Ellis's effort?
I think it stood open for some time unfilled because we couldn't recruit anybody, but I would have to check to see if that position.
Okay.
We'll find out and let you know.
Okay, great. Because that would be part of this.
Just on one final note, I think as this bill moves forward, that timeline of the vacancies that are being filled currently under this current fiscal year, the proposed timeline, the redescribing of positions, if you could suss that out for us and make sure that when it goes to the next committee, because I think those kinds of questions are going to be asked. And if the process of interviewing is occurring and you're filling positions, we need to know that, because I think the more quickly you fill positions and demonstrate the need for the additional positions, and that there's people waiting in the wings to fill those positions, the more likely you will get the support for the new positions.
Thank you. Thank you
All right, members, thank you. We'll be moving on to the next measure. House Bill 1895, members. This relates to dispensing of contraceptive supplies 3-month versus 12-month supply. We have comments from Commissioner Ito. Thank you. Testimony in support, Planned Parenthood.
Good morning. I'm Lori Field, Hawaii Legislative Director for Planned Parenthood Votes Northwest and Hawaii. And we thank you very much for hearing this bill today. We think it'll go far to ensure that women have a reliable and consistent supply of the birth control pill, and in turn reduce unintended pregnancy and its cost to taxpayers. We just wanted to note that we would like an amendment to this bill that would remove the 3-month requirement, remove language that allows insurers to only cover 3 months for the first dispensing of the prescription. We believe that decision about whether and when to continue taking the birth control pill is best determined by a woman in consultation with her doctor, and so we'd prefer that language to be taken out. And that's it. Thank you.
Thank you. We have testimony in support, Hawaii Medical Association. Thank you. Testimony in support, ACOG.
Also stand on testimony in support.
Testimony in support, Kaiser Permanente.
Good morning, Chair, Vice Chair, committee members. Excuse my voice. Thank you for the opportunity to testify. Kaiser supports the intent, but has some concerns about its potential impact. Kaiser currently prescribes up to a 90-day supply, and we support accessibility by promoting our home delivery system. Our concerns, based upon, I think we share with a lot of others, is the potential for waste if the woman does decide to stop using the supply or changes medications. But also keep in mind that when you do an overabundance of supplies like this, you do lose physician monitoring, which is important to Kaiser. Every drug has side effects, and the idea that these resupply visits for less prescriptions allow the physician and the member to discuss possible alternatives if there are side effects, and kind of fit the contraception to their needs and to their health. So that's a concern for Kaiser. And also when you give a year supply, there may be enhanced expectation that this drug is just safe, go ahead and take a year. But when in reality, there may be effects that can be addressed at each resupply visit with the physician. Thank you for the opportunity to testify.
Thank you. Testimony in opposition, Mr. Chikamoto. And members, this is the typical one. We have to always to address the disability insurance. So it's testimony we've seen in other instances on bills related to insurance. Testimony in opposition, CVS Health.
Aloha, Chair, Vice Chair, members of the committee. My name is Annie Makapagal on behalf of CVS Health Longs Drugs. And we do want to clarify, we do oppose the bill, but as written, and we would like to thank Planned Parenthood for their suggested amendment, and we concur with that. So our opposition level is kind of turned to strong concern now. So,
okay.
But we also do echo the sentiments of Kaiser.
Okay.
Thank you.
Thank you. Comments, Chamber of Commerce? Comments, HMSA?
Chair will stand on our comments.
Thank you. Testimony and support, Joy Marshall. Testimony comments, EUTF. Thank you. Comments, DHS?
We stand on our testimony as written.
Okay, and in support, AAUW. Any other testifiers? Seeing none, members, questions? Questions? Go ahead.
How about ACOG? Well, tester. Representative Kaiser mentioned the complications and risks of birth control pills. I think that the ones currently are less risky than they used to be, but still, what are some of the risks of birth control pills? In other words, what life-saving risks? The risk of causing death.
In our testimony, we do list some of the side effects, but actually ACOG's national policy is to support a 12-month supply, including over-the-counter, actually, because there are side effects, but they think that the risks of unintended pregnancies are of greater concern, basically. So.
Okay. In other words, like pregnancy and unintended pregnancy would be more risky to the health than clots from contraceptives and things like that. Yeah, but do you think that, so their position is that the education they get when they bought it would be enough?
Well, their position is for oral contraception, not for like injectables or implants, obviously.
Right.
But for oral, their position is that it's actually better to just have the access.
The risk-benefit favors the access, even though they're high risk.
Right.
Because pregnancy is a high-risk thing.
Yeah.
Okay. Thank you.
Thank you. Stay there. Any other questions? Kaiser and CVS. And you can flank ACOG. Okay, so I do want to point this out because there's like conflicting medical advice on this. On one hand, you say that you don't want to have it prescribed or readily accessible because of the effects. But then within the industry, within the medical industry, they're pushing over-the-counter 12-month supply. So that indicates that there is not a whole lot of risk. So it seems to me what the issue is, it's the issue about prescribing and insurance and the payment methodologies, right? There's some, and that's when you bring in your testimony about the ACA, EUTF comes in, well, we don't really want to necessarily to fund someone if they're not going to be on the rolls for over 90 days, right? So what I'm wondering is, and then there's a concern about notification to the physician. I'm wondering if some of the concerns will be alleviated by some of the amendments suggested by Planned Parenthood, but also if there is some way that if we can ensure that the pharmacists who say it is an injectable, right, if the pharmacist notifies the prescriber, the physician, of the fact that they're going to be doing it. Because I think what the issue is, right, is if a woman has to come in every 3 months to get an injectable at the doctor's office, that's where the challenge of access occurs. So if it's something that could be done by the pharmacist and then allowed to be notified to the provider, that might relieve some of the issues around this 3-month, 12-month supply and the pharmacist being the person prescribing it or dispensing it. Is that something? And then I will say that what's happening is when contraceptives are sold over the counter in other places, what we're finding in other jurisdictions is it's actually a way to escape the insurance coverage. And that's something that we don't want because ACA has provided for insurance to cover contraceptives. So there's a little bit of when you push contraceptives over the counter, you're actually then making it more expensive potentially.
Yeah, that's the problem.
And that's the problem.
Yeah.
Okay. Any comments to anything that I just said? And this clearly is going to be a bill work in progress. But I think it's touching on all of these issues of access, insurance payment methodology, and patient safety because of notification to the physician. Comments? You can say no comment.
Just a comment. We're more than willing to help draft some language, and we're currently we will be meeting and discussing all the issues. So I don't believe Kaiser is on the list, but we'll include.
Yeah, we're actually having a meeting on this.
Okay, and I apologize, I'm realizing I'm asking comments to the next bill, but it all kind of connects, right? The 3-month, 12-month supply, and who gets to dispense it or prescribe it and dispense it is all kind of connected.
And the pharmacist, I think the next bill has to notify your regular appointed physician within a 3-month period of time. That's what I do.
Last question?
So, I mean, it's not that these are low risk. It's just that one high risk or relatively high risk outweighs the other high risk. In other words, the high risk of pregnancy outweighs the high risk from contraceptives.
Right. I mean, there's definitely.
But injectables even have a higher risk, don't they?
Yeah, there's definitely side effects and risks associated with it. So I guess that the hope is that.
Was it ACOG's position that the injectables could be?
No.
No, the injectables, they're more concerned about those.
Yeah.
Because they are definitely higher risk.
Their position is really pertaining exclusively to the oral contraception.
Okay.
Yeah.
Okay. In other words, I guess the bottom line is the injectables are not the same.
Right.
The oral has a high risk, but the pregnancy is even higher. But then the injectables are even higher still.
I'm not a doctor, so I don't actually know.
Oh, yeah, okay.
But
I think that's the case. But
I can bring that back to them.
The question means how much higher, I don't know.
Yeah.
It's definitely higher.
Yeah. And the high risk in the injectables is the risk to the patient. That's the clarification versus the risk of pregnancy. You're talking about when you say the risk.
Right. Oh, yeah, the side effects from the,
I think the
like
injectables
clots.
are monthly, right?
Well, they may have a depot that goes 3 months. I don't know. I'm not sure.
All right. Thank you.
Okay.
Any other questions? Thank you. Okay, moving to House Bill 1896. This is the one we related to the pharmacist being able to dispense. Members, I apologize that my comments will extend to this bill as well. It's actually the bill proposes the pharmacist to prescribe and dispense contraceptive supplies. Okay, comments from Board of Pharmacy?
Good morning. My name is Leanne Tashima. I'm the Executive Officer for the Board of Pharmacy. I was going to stand on our testimony that was submitted a few days ago. Since then, though, when the Senate committee heard this similar bill on Tuesday, Senator Baker asked the parties to get together. We have a conference call on Monday. We'll be making recommendations to clarify the prescriptive authority for the pharmacist to prescribe. The board is looking at only the practice of pharmacy side, not the insurance or reimbursement side. But we are trying to mirror it after the Oregon state law that was just took effect. So we would recommend that it be limited to the oral hormonal patches and oral contraceptives only, and not allow pharmacists to inject. So I just want to clarify that since you were discussing that.
Thank you. Okay, we have testimony in support from LGBT Caucus Democratic Party of Hawaii. Testimony in support, Planned Parenthood.
Lori Field, Planned Parenthood Votes Northwest in Hawaii. We support this bill, and we think that it will go far to ensure women's access to contraception. We do have a few concerns. Most importantly, removing the 18-year requirement. The person has to be 18 to get a prescription from a pharmacist. Minors are able to contract for these services on their own, and so there's really no reason to add this arbitrary age requirement. We have a few other concerns about this bill, including making sure that pharmacists have the proper training to provide counseling to women about other contraceptive options, and making sure that they're reimbursed for that counseling as well. In addition, we'd like the clinical visit to be defined, making sure that depending on women's age and health history, determining what care women must get to qualify for this pharmacist prescription. And finally, we just want to make sure that women are given counseling from pharmacists about other contraception. Thanks.
Thank you. Testimony in support, Hawaii State Coalition Against Domestic Violence. Testimony in support, HMA. Testimony in support from ACOG. Testimony and support from Kaiser. Thank you. Testimony and support CVS Health. Opposition ACLI. Comments HMSA.
Stand on our comments and support.
Thank you. Testimony in support Joy Marshall. Testimony in opposition Mary Smart. Comments Rachel Wong DHS. Okay, thank you. Testimony in support HPHA. And testimony in support AAUW. We have in your late folders, members, testimony in support Hawaii Women's Coalition. Comments, Carolyn Ma, PhD, UH Hilo. Testimony in support DOH.
Stand on our testimony.
Thank you. Testimony in support Dylan Armstrong. And testimony in support Hawaii State Democratic Women's Caucus. Any other testifiers? Members, questions? Go ahead, Representative Tupola.
Hi, can I have the Board of Pharmacy? Hi, good morning. Thank you for coming. I think probably things will work out with the phone call, so maybe we'll wait to hear back from that. My question was in one of the sentences in your testimony, you said 21 states allow pharmacists to prescribe based upon test outcomes that must be in collaborative practice agreement and or protocol with prescriber or practitioner prescriptive authority. What is that?
So, according to the National Association of Boards of Pharmacy 2015 or 2016 law survey that we just received, one of the questions was, can pharmacists prescribe? And those that answered yes all had a footnote that it was pursuant to a collaborative agreement with a licensed physician.
So, do we have that here in the state of Hawaii then? Oh, so the pharmacists do have the right to prescribe?
No, we don't. Pharmacists can work collaboratively with a licensed physician or advanced practice registered nurse or dentist, but they don't have prescriptive authority at this time.
So it varies, some do, some don't, is that what you're saying?
In those states, they can write a prescription.
In other states, I see what you're saying.
But not in Hawaii.
Not in Hawaii. They can write that prescription themselves from the pharmacy.
In other states.
So is that phone call you guys are having on Monday working that out? Or?
Yeah.
Okay.
Because this bill would allow a pharmacist to
prescribe. Right. So that's what you guys are going to try to align.
Right.
Okay.
Right.
Got it. Thank you. My Chair, one more question, please. HMSA. Are you here for HMSA? No. No, in the back row. Kaiser. Sorry, Kaiser. Can I ask you a question real quick? Oh, wow. No wonder he was looking at me like, what? Sorry, in someone else's testimony, they had said that the insurance providers would have to reimburse pharmacies for this. Is that an issue or is that not an issue?
Since we're in you mean the outside pharmacists?
Yeah. Is that, for the pharmacists that have to prescribe, would they then have to work with the insurance providers to try to get reimbursement for that since they'd be writing the prescription?
Yeah, we have contracts with our outside retail pharmacists.
So this wouldn't be an issue?
No, it wouldn't be.
Okay.
Kaiser currently, we prescribe emergency contraceptives right now, the morning after pill.
Okay.
But yeah, we don't have any prescriptive authority beyond that.
Okay, those are my two questions.
Yeah.
Thank you,
Thank you.
Kaiser.
Thank you.
Okay. So I guess what I'm trying to clarify is in other states, it's not so much a prescription authority, it's a protocol that allows them to dispense medication. But the prescription is really based on a protocol. I mean, they aren't just making it up.
Right.
Right?
Yes.
So they can't just do it. They have to have a collaborative agreement
Right.
because the protocol protects both the patient and the pharmacist.
Right. Yeah, so it was a little
and the public.
misleading, that question and the responses, especially when they all had a footnote about
Right.
the protocols and policies and procedures. So, I just want to let you know, too, that currently pharmacists can initiate a prescription for emergency contraception. They are in a collaborative agreement with a specific physician. So they initiate the oral emergency contraceptive therapy. And then there's protocols and procedures that they refer the patient to the physician if they don't have one of their own. And the prescription is also under the physician. Thank you.
Seeing no other questions, members, go ahead.
I'm not quite sure if you're the right one to answer, but I'll ask this question. I know this bill is relating to contraceptives. Birth control is also prescribed for individuals that might have endometriosis to low dosage to help regulate your hormones. So has that been discussed and possibly pharmacists prescribing this as well? Because that's not prescribed for contraceptive.
Right, right.
So I'm just, this is also something that I'm hoping the introducers are also looking at as well.
Okay.
Because, the longer you take, contraceptives, you get the side effects from them as well, right? Yes, if you take them longer than 10 years, and if you're a smoker, et cetera, et cetera. So I'm hoping that discussion is also being had as well.
Okay.
Thank you, Chair.
Okay, members, just for your edification and the audience, the series of insurance women's related bills, we're going to defer this for DM till Monday 3 p.m. All right, we're going to take up the dengue ones, and we'll do decision making at probably around closer to 11:30 today. And for the 9:15, the people who are here for 9:15, we're getting to you real soon. So we will open up that agenda quickly. We just have one last bill on our 8:30 a.m. agenda, House Bill 1897, relating to insurance coverage of health screenings. We have testimony, comments from Board of Pharmacy. Comments, DCCA. Support, LGBT Caucus of the Democratic Party of Hawaii. I'm sorry, this is 1897. 1897. Let me scratch all that. Comments, Director of Health. Thank you. Comments, DCCA. Thank you. Testimony and support, Lori Field, Planned Parenthood. Support, HMA.
So we're in support of this bill, but we had a suggested amendment for line 15, page 2, where it says shall provide insurance coverage for sexually transmitted disease screenings, including HIV and immunodeficiency syndrome. We would ask that it be changed to as follows: shall provide insurance coverage for sexually transmitted disease testing in accordance with national professional guidelines, such as those of the U.S. Preventative Services Task Force and Centers for Disease Control and Prevention.
Thank you.
Thank you.
Testimony and support, HMSA. Thank you. Testimony and support, ACOG. In support, Kaiser. In support, Chamber of Commerce. Opposition, ACLI. Support, Joy Marshall and Michelle Roca. Comments, EUTF. Thank you. Testimony and support, Ann Freed, and testimony and support, Dylan Armstrong. Members, any other testifiers? Seeing none. Members, questions? Yes. Representative Fukumoto.
Thank you. HMA? Thank you for your amendment. I just wanted to check the U.S. Preventative Service Task Force and the National Professional Guidelines. Would that be any less than at least once a year?
It actually kind of changes depending on, I know that for young women, they've recently changed it to every 3 years. So, that's.
And are there any guidelines that would allow a woman to do? Is there a way that we can come up with an amendment that would still allow you to get it once a year instead of?
I don't know. I think that the intent of this is basically if there's a new test or coverage that then you won't have to change the statute to cover it. It would just be already included in statute because that would be what's considered medical standard now, as opposed to having to change the statute every time they change the protocol.
Okay, so you think it's probably this? If we change this language, we'd be looking at instead of maybe once a year coverage, every 3 years.
It depends on your risk and age group and prior medical history.
Thank you.
Thanks.
Can I? Any other questions? Seeing none, HMSA. So this is kind of along the question of annual versus triennial. Is it the current status where an individual can get annual screening under the current coverage?
I'm just checking the concept of annual, but...
Once a year?
I'm sorry, I don't know. I have to...
Okay, because that's what the proponent, I think, is interested in, right, is that, but I guess it would be a conversation between the doctor, the risk factors, and if there's any barriers for a patient to get that screening, that's what we want to address, I believe. So as we move this bill forward, as we talk about it.
I'll reconfirm that, but yeah, I mean, it's, under the federal law,
it's mandated.
Mandated.
Yeah, so then the question is, at what times is it mandated? Okay. All right. Any other questions? Dr. Green?
Maybe for ACOG. I mean, part of the problem with those guidelines is you don't know a woman is necessarily at risk unless you examine her, right?
Mm-hmm.
I mean, if you have other, say venereal diseases such as chlamydia, or the cervix is more likely to pass the HIV.
I'm not qualified to answer that question, I don't think, but I think that I'm hoping that they do take your maybe some lifestyle factors into consideration. I think they probably would.
Given the relatively high prevalence of chlamydia in Hawaii, I think it would be wise to err on the side of caution in terms of allowing people annual rather than...
Right, and we did list that in our testimony that Hawaii is...
Yes, thank you for that.
...very high on. Yeah.
Okay.
Thank you.
All right. Members, that finishes and wraps up our 8:30 a.m. agenda. We're going to recess this for decision-making, and we'll pick it up for DM at 11:30 with the notations that House Bill 1895, 96, and 1897 will be deferred for DM till Monday of next week at 3 o'clock p.m. All right? So we are recessed, convening our 9:15 a.m. agenda. First up, members, is our House Bill 1944, sort of our telehealth omnibus bill. We have testimony in support. This is House Bill 1944 from State Council on Developmental Disabilities. Comments? Hawaii Medical Board. Testimony in support, HAH. Thank you. Testimony in support, Planned Parenthood. Testimony in support, Queens Health Systems.
Good morning, Chair, Vice Chair, and committee members. My name is Paula Yoshioka. I'm a VP at Queens. We wanted to apprise the committee. The bill was heard yesterday in Senate Human Services and Health, and we proposed some changes to the bill that we would like to walk through with you. There is an understanding, though, with Senator Baker that she would like to see actual proposed language by next Tuesday. So we wanted you just to be aware of what was going on. So I'm going to have, this is Dr. Matt Koenig. He is our medical director for telehealth at Queens. Have him walk you through the 4 points that we'd like to bring up.
Thanks for hearing my comments. I want to preface by saying we're in strong support of the bill. The intent of the bill is very, very good. There's just some clarifying language that we would like to suggest, most of which is actually in current statute. And if you'd indulge me, I'll go through the 4 points in my written testimony.
Thank you.
The language in the, again, in existing statute, and that's retained in